Hello, everyone, and welcome to the latest entry to my CRPS Research Breakdown series. In this series, I am going to spend every single week for the next several months going through the most common treatments for CRPS and talking to you about the research that supports or the research that doesn't support some of these treatments. The reason I am so passionate about this series is because what I have discovered after going through CRPS myself and then becoming a pain specialist and helping people all over the world with CRPS is that much of the research online in Facebook support groups, in Reddit communities, and even on nonprofit organization websites for CRPS, much of that information is misleading and false. And so this series is my effort to correct that information, reduce your fear, and help you move forward. So if you are enjoying this series so far and you haven't already, please subscribe to the channel. Make sure to leave a like because every like that you leave on the video helps other people suffering with CRPS find it. And without further ado, we'll jump into this week's video. Today's video in the Research Breakdown series is going to be all about support groups. I'm going to tell you the good, the bad, and believe it or not, the ugly that you may not know about support groups in the chronic pain and CRPS community alike. I'm going to use actual, real life research on how support groups can keep you trapped in a fear and pain cycle that is not only never ending, but can make your pain markedly worse. And then I'm going to show you real life examples and personal experience to help you make a decision if support groups are a good place for you to be. Today, to support my argument and stance on support groups, I am also going to show you a video from my online course about the placebo and nocebo effect. This video that you will see within this research breakdown video is one of 78 current videos in my online course. And so if you find it useful, you can obviously find the rest of those videos on my website, thewindowpane.com. After this video, if you are looking for a good support group to join, you can always join the Window Pane support group on Facebook, which you can see here on screen now. We have almost 2,000 members, and it is a great place to find hope, tools, and resources completely for free to help you move forward and out of pain. Before I get into the research about support groups and the good and bad alike, I think it's important for those of you who have just found me that I introduce myself. First and foremost, my name is Chase Teagarden, and a little over 11 years ago, I myself was diagnosed with complex regional pain syndrome. For 4 years, I struggled in pain going to doctor after doctor, taking 16 pills a day and eventually being unable to wear a sock. I used a walker to get around and at my lowest, begged 3 different doctors to cut my leg off, even eventually contemplating taking my own life. Thankfully, I did not do that and went my own way. After that, I found my way out of pain and went on to become a doctor of physical therapy, therapeutic pain specialist, and one of 60 fellows of pain science in the nation. I now help people all over the world overcome this pain and move on with life. Depending on when you are seeing this video, you may recognize me from the Trial by Fire 2 CRPS documentary that is airing on one of your favorite streaming platforms, or you might also recognize me from the Freedom from the Fire mini documentary that showcased over 35 of my clients who have moved forward with their life and are finding meaning and fulfillment every single day despite their diagnosis. If you would like to be one of the many clients in this video, you are welcome to visit my website, thewindowpane.com, at any time to find my resources. So, in diving into the research aspects of CRPS and chronic pain support groups alike, I want to answer a simple question. Are support groups helping or are they hurting? And there is something happening every single day in chronic pain communities that I think we need to talk about. What is happening is someone develops a strange sensation in a certain part of their body, and they go online and they ask, could my CRPS be spreading? And within minutes, someone responds, that's exactly how my spreading started. And then another person might say, mine spread after surgery. And then someone else says, mine eventually spread everywhere. And suddenly, a sensation that might have been absolutely normal or have nothing to do with CRPS at all has acquired a completely different meaning. Now, to that person, to that commenter, whatever sensation they're experiencing in their body means danger. And the person who came to comment looking for reassurance might actually leave more frightened than when they arrived. That brings me to the question I want to explore today, which is, can chronic pain support groups sometimes make recovery harder? Not because the people in the support groups are bad, not because they're intentionally spreading misinformation, and certainly not because people experiencing chronic pain shouldn't be supported, but because the human nervous system is incredibly social by nature. We learn from each other. We learn expectations from each other. We learn fear from each other. We learn what sensations mean from each other. And sometimes what feels emotionally supportive in the moment may actually unintentionally reinforce the very threat, fear, hypervigilance, and avoidance that chronic pain rehabilitation is trying to reduce. So today, we're going to look at what the research actually says about support groups as a whole. So I want to make something super clear before I go any further. This is not an anti-support group video. Human beings, we need connection. And chronic pain can be incredibly isolating. Sometimes meeting another person who genuinely understands what you're experiencing can be enormously validating and comforting. In fact, there is research showing exactly that. A randomized controlled trial published in the Journal of Pain investigated Facebook support groups in adults with chronic pain. 119 participants were randomized into different Facebook group conditions, and the researchers found improvements in several pain-related and psychological outcomes associated with participating in those support groups. So there's absolutely evidence that online peer support can be helpful. And we actually even have some small research looking at specifically CRPS. Researchers created an online peer support forum and analyzed posts from 26 people with CRPS over 12 months. Social support was present in almost 89% of posts, and emotional support appeared in nearly 73% of posts. The researchers described the overall environment as positive and supportive and found that it helped participants connect with one another and, in some cases, re engage with the world outside of the group. That matters. And a caveat here is that that particular study was a very small amount of people. And today I'm going to be talking about massive support groups, such as those online right now of over 20,000 people. But basically, loneliness isn't my recommendation when it comes to support groups as a whole. Isolating yourself from support isn't recovery, and telling somebody to stop talking about your pain and deal with it yourself would be completely contrary to what we know about human beings as a whole. So the question today isn't, are support groups good or bad? The better question is, what is the group that you're in actually reinforcing? Because a community can reinforce hope, they can reinforce agency, movement, confidence, recovery, connection, or they can reinforce threat, helplessness, fear, avoidance, catastrophizing, and actually encourage a constant monitoring of your body. Both of those groups can feel like support, but both of them will have a very different effect on the person receiving it. The information in a support group will especially have an effect on your nervous system. And here's where things get fascinating. We often talk about pain as though it exists entirely inside one person's nervous system. But humans don't operate that way. Our brains are continually taking information in from the people around us, and we look at other people to determine, is this dangerous? Should I be afraid? Is this normal? What should I expect? And that process doesn't magically shut off because we're communicating through a screen. In fact, in 2024, researchers analyzed interactions inside large chronic pain community groups on Reddit. They analyzed over 73,000 comments from nearly 200 users, and they found something remarkable. Users tend to synchronize the emotional tone of their language with the people they interact with. Researchers called this affective synchrony. Even more interestingly, across the community on Reddit, there was an overall trend towards increasingly negative language as people continued to participate in these groups. Now, there was an important nuance. Long-term and short-term users behave differently, and participation could be associated with both positive and negative trajectories depending on how people interacted. So, this evidence isn't saying that Reddit makes everybody miserable, but it is evidence of something incredibly important. The emotional environment of a chronic pain community can influence the emotional communication of the people inside of it. And so, what that means is emotions are contagious. This is why I would argue that we shouldn't only ask, is this group supportive to me? We should ask, what emotional state does this group repeatedly pull me towards? Do I spend 20 minutes reading Facebook support group information and come away thinking, I can do this, I can overcome, I can heal from CRPS? Or do I spend 20 minutes on the group and come away thinking, oh my God, what is going to happen to me? The pain's going to spread all over my body and there is no hope for me. Because human beings, based on the research I've just presented, can co-regulate one another towards safety, but we can also co-regulate one another towards danger. And you guys have experienced this not out, even outside of CRPS when you think about, let's say, the news. If you go back just to even 2020 and you start to think of all the news programs talking about COVID-19, no matter your opinion on COVID, you can certainly agree that we were all high stress during that time. We were co-regulating one another towards fear. And then as time went on, we were co-regulating each other towards less and less fear as we returned to normalcy in life. And so that's just one example of how groupthink can kind of take over. One of the most researched psychological variables in chronic pain is something called pain catastrophizing. And I want to be careful with this word because it sometimes is used terribly. Catastrophizing does not mean that your pain isn't real, and it doesn't mean that you are being dramatic. It certainly should not be used to shame someone who is suffering. So when I say pain catastrophizing, I am not saying that you are being dramatic or overreacting in any way. Pain catastrophizing simply describes a pattern involving things such as rumination, meaning I can't stop thinking about the pain, magnification, meaning this sensation probably means something terrible, and helplessness, meaning there is nothing I can do about this. Those thoughts are totally understandable when somebody is frightened, but understandable does not necessarily mean helpful thoughts. So imagine hundreds or thousands of frightened people communicating with each other in a Facebook group. You see this all the time when you're online. Someone writes, my opposite foot tingled today. Has anyone experienced this? And then people respond with, yes, that's how my spreading started. Mine became full body. Be careful. Don't push yourself. Mine never went away. What has happened? Nobody intentionally harmed this person. Everyone genuinely believes in their comments that they're helping. But an ambiguous sensation, such as a tingling in a foot, which could happen for a number of reasons, has just been given a catastrophic interpretation. Tingling has turned into spreading CRPS. And this particularly matters in CRPS because a study published in Pain Medicine examined illness perceptions in 53 people with CRPS types 1 and 2. And the researchers found that more negative illness perceptions were associated with greater pain, greater disability, and more fear of movement. One particular interesting finding was that people who attributed more symptoms to CRPS also reported greater pain intensity. And poorer understanding of the condition of CRPS was associated with greater disability in the long term. Now, notice what that study does not prove. It does not prove that negative thoughts caused someone's CRPS. It does not prove changing someone's thoughts automatically removes their pain, but it shows something clinically important. The meaning someone gives to their symptoms is associated with how they experience and respond to their condition. And social groups help create meaning. This is the reason why this series is so important to me, because the misinformation on Facebook support groups, Reddit support groups, TikTok, and even nonprofit organization websites, some of the most popular ones, the misinformation in those places is rampant. And so, what I want to do today, as an effort to correct some of this misinformation, is lay out in this section of the video some of the information I share with people in my online program about the truth when it comes to CRPS, types, staging, remission, etc. And so, let's jump into that right now. First, let's talk about the definition of pain. The definition of pain given by the leaders in pain research, so the International Association for the Study of Pain, is that pain is a unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential slash perceived tissue damage. And what this definition means at its core is that pain is complex. Pain is not always associated with damage, and pain can be mediated by our emotional experience. And the reason understanding that definition of pain is important and understanding pain as a whole is important is because there's a lot of research that shows our understanding of pain can actually reduce our pain. So by the end of this presentation today, watching this video, you might actually find yourself in less pain just from learning what you're about to learn. So let's continue. A lot of times, fear and anxiety around a condition will increase your pain. So, for example, when someone goes to get a MRI, they will have more pain just from the doctor showing them their image and pointing out something that is quote unquote messed up. So if you have CRPS and you are seeing images of agony and pain and discomfort, that alone increases your pain. And one of the first things that I saw with CRPS is the McGill Pain Index. And the McGill Pain Index is subjective reporting of pain. So people are saying what the pain feels like, and it's ranking it CRPS at the top. That is scary as hell. That fear ratchets up, and we experience even more pain just from seeing an index like this. And this generates a cycle, which is called the vicious cycle of pain. So you'll have pain, you'll create anxiety, or you'll get anxiety in your mind that pain is signaling tissue damage and harm. The brain becomes more focused on that problem. You start Googling, you start searching for answers, you start going to multiple doctors. Your nervous system changes further because you become more nervous. Then you have more pain. Then you move less and have more anxiety. And then your nervous system changes more. And then you have pain again. And the cycle repeats. This cycle is both physical and psychological. So, as you can see in this example, you will avoid activity, you will decondition progressively. You will have more pain because you haven't been active. You'll avoid activity more. You'll decondition more. And then at the same time, you're developing anger, anxiety, and fear and distress. Your mood is getting worse. You're becoming depressed. And when you're depressed, you have an increased perception of pain. Things hurt and feel worse. Thankfully, this cycle can be broken. And the way that we break this cycle, as you can see, injury, or for some of you, CRPS came on with no injury at all. You have a pain experience. You start to catastrophize as you read information on Facebook groups and nonprofit organizations and other places. You have pain-related fear. You become hypervigilant and you avoid things. You become depressed, and for some of you, become even more disabled. And then you have another pain experience, and then the cycle continues. But as you can see, if you have no fear, if you confront the situation, you can move towards recovery. Okay, so take a look at this chart, really soak it in, and remember that big part here. There's a pain experience, and then there's no fear. No fear. We want to move forward and take on life again, confront the situation. A lot of you in Facebook groups, you will see what I call alphabet syndromes, co-diagnosed with CRPS. Some of these alphabet syndromes which I am writing a book about. Here's the mock cover. Some of these alphabet syndromes are CRPS, of course, AMPS, fibromyalgia, POTS, PANS, PANDAS, tinnitus, insomnia, EOE, FND, MALS, MCAS, chronic Lyme, mold, TOS, ARFID, EDS, and other chronic pains, itises, or syndromes. What is happening with these conditions is all of them are a result of nervous system overload or intense activation of our sympathetic fight or flight system, which means if you can calm the fight or flight system, most, if not all, of your symptoms of all these conditions will reduce or go away. Let me say that again. All of these are a result of the same problem, an overloaded sympathetic or fight or flight nervous system, a central sensitization of your alarm system, which we'll talk about here. The nervous alarm. So when it comes to pain, if you step on a nail, your nervous system has an alarm system that goes off to alert you that you have been injured. There is a spike in fight or flight sympathetic activity that crosses a threshold of where you will get a pain message. And then after that spike is done and your foot is bandaged and you're healing, that spike comes down. However, for 1 in 4 of all people, for a variety of factors, which we'll talk about in Module 3, when you step on that nail and it goes up above that messaging threshold, sometimes it doesn't come back down to normal level, and we stay up at extra sensitive with a hyperactive alarm system. When we are sensitized for that long, we start to have symptoms that lead to these alphabet syndromes. Okay? Anything can trigger this alarm. It could be a pain event. It could be bad medical information. It could be information shared by people suffering. It could be information read on Google. It could be stressful life events such as traumas, deaths in the family, taking care of others at the expense of ourselves, etc. It could be medical, personal, and physical traumas. And lastly, of course, beliefs about our bodies. An example of an alphabet syndrome from the past is SUNS, sudden unexplained nocturnal death syndrome. This took place, I believe, in Laos, and there were 117 deaths, mostly male. There was no explanation at all, and they were an average age of 33, fully healthy, and the only link to their deaths was heritage and culture. And what these males described is at night when they would go to bed, they would feel this overwhelming sense of doom. And they would explain that in this overwhelming sense of doom, this sleep paralysis demon or monster would come in and those men would die. And medicine could not figure out what the problem was. These men were completely healthy, and it was only linked through their heritage and their culture and their beliefs about what was happening to their body. Pretty wild, huh? And in fact, this monster or this story is what inspired the Freddy movies, the Nightmare on Elm Street movies. So, quite a scary thing to see. But what I want you to think about is how is this similar to complex regional pain syndrome? How does this resemble CRPS? The big ways are no doctors understand what's going on, and the more that we fear it, the worse things get. That is why I need to break down the terms around CRPS, such as types, stages, spreading, and remission, and why they are helpful and harmful. So when it comes to CRPS, the types, type 1 and 2, have no difference. Literally all the typing is doing is telling you how you developed CRPS. So with type 1, CRPS started without a clear injury to a nerve, and that's it. There was not a clear nerve injury. It came on insidiously, meaning with no clear reason. That's type 1. Type 2 is CRPS starting with an assumed direct injury to a nerve. That's it. Okay, so whether you're type 1 or type 2, the treatment is still the same. Literally, all the types are doing is naming for you how the CRPS came on. That's it. Stages. Stages is actually an outdated term. They don't even use it anymore because people can fluctuate between stages at any time, any given day. And it is believed by some people that stages are inevitable, meaning you're going to start with stage one, you're going to have, a little bit of fluctuations in skin temperature, you're going to have muscle spasms, et cetera, et cetera. And then you're going to move to stage two, where your skin's going to continue to get worse and your nails are going to fall apart and your hair growth's going to slow down and your joints are going to get stiff and your muscles are going to weaken. And then stage three, they're talking about getting atrophy and loss of bone density and a whole bunch of stuff like that. These stages don't exist anymore. We don't even use them in medicine, for one. For two, they are not inevitable. Literally, someone can be in quote unquote stage one, and then the next day, when they have a flare for a variety of reasons, which we'll talk about, they'll be in stage three. The biggest thing I want you to know is that the atrophy and the bone density loss and all of those things that are associated with CRPS, they are completely reversible. The only reason those things are happening is because you're not using the limb. If I tape my healthy arm to my body and I don't move it for a phase of time, my muscles are going to shrink. My bones are going to lose density. That makes total sense. But then, using a concept called Wolff's Law, if I start to exercise again, even if just a little, my bones and my muscles will rebuild. It will come back. And you can see this when you look at celebrities. They do this all the time for roles. Christian Bale's a great example. You can have a bunch of atrophy and muscle shrinkage, and then when you exercise, it can come back. The only reason that the atrophy and the bone density loss is happening is because you're not using the limb. It is not because CRPS is some sort of poison or venom that is taking away your bones. That is not what's happening. Spreading. This is probably the biggest frustration for me when it comes to CRPS because, yes, CRPS can spread and that does happen, but it's not for the reasons people think. The only reason this spreading is occurring is because your nervous system alarm is becoming more hyperactive. It is not a venom or a cancer that is spreading through your body. That is not what's happening. Usually, spreading will happen in a mirrored pattern because of something called the sensory motor cortex, the layout of your brain. And as you get into more pain and your brain adapts more to that pain, you can see spreading happen from one side to the other. But again, it's only because our nervous system sensitivity is ratcheting up, not because you have a venom that went from your left hand, skipped every other part of your body, and showed up in your right hand. Okay, just think about that logically. That does not make sense. Yes, you are feeling it, but you don't have a poison going through your body, and you can reduce that spreading through the techniques I show you in this course. The spreading can also commonly happen at sites of other break-ins. So a lot of times I'll have clients who will say, I started with CRPS in my hand, and then in my right shoulder, I had rotator cuff surgery a couple years ago, and now I'm having pain there again. Don't panic. This is all reversible. And that reversing comes with calming our alarm. Giving you other examples of our nervous system alarm freaking out and what can happen, we can have color change, bruising, swelling, itching, cramping, pulsing, throbbing, shifting, moving, sounds. Lights can become hypersensitive for us. We can get lightheadedness, vision changes, dizziness, stomach issues, swallowing issues, etc. No matter the symptom you're experiencing, the plan for improvement is always the same. We need to calm down the nervous system. We need to calm down the alarm. So if you look at the sympathetic nervous system and the things that are happening when we are overloaded or when that's activated, it looks a lot like the symptoms of CRPS, right? Heart beats fast, or any alphabet syndromes, right? So heart beats fast, that could be like POTS. Breath is fast and shallow. Pupils of the eyes can expand, make you sensitive to light, right? Your gut becomes inactive. You could get gastroparesis. Your blood rushes to your skeletal muscles and away from your brain, making it hard to think clearly. Hormones rush through your body, making you feel anxious, and it expends your energy, making you fatigued. That is sympathetic nervous system overload. But switching to calm that sympathetic nervous system, allow the parasympathetic nervous system to do a little more work, it will calm you down, it'll prepare you to rest, and it'll help you think and restore. Your heart will beat slower, your breath is full and shallow, your pupils will shrink, making light less sensitive, your gut becomes more active, you get increased blood flow to your gut, lungs, and brain, meaning you get more clear focus, reduce brain fog, your hormones rush back in, helping your mood, helping you relax, and you regain energy. That is how we calm the alarm system. In module 4 of my online course, I talk about how to calm the alarm system from a physical perspective, which is half the battle. And then in module 7 of my online course, I talk about how to calm the alarm system from a mental and emotional perspective, which is the other half of the battle. And so if you would like to learn that process, you're welcome to check out my online course at any time. But for now, what I want to talk about is what I call the 6 R's to calming CRPS and reclaiming your life. And they are as follows. By the end of this video today, if you take my advice, you're going to be reducing negative self-talk and reducing the consumption of negative info. You're going to retrain the alarm in the physical way, and then you're going to retrain it in the emotional way by reprocessing your emotions. And then finally, you're going to reimagine your future and reclaim your life. Lastly, I'd like to talk about the problem with the term remission. Remission is great when it comes to insurance, disability, or legal battles. Okay. However, remission is not an accurate term when it comes to CRPS. It is very harmful for our mental state. So, this is what I want you to think of. I call myself recovered because I'm out of pain and I literally have no fear of CRPS ever coming back. Okay. If I was to consider myself in remission, I would always be worried and looking over my shoulder about, oh no, what if I go to the dentist or what if I sprain my ankle and the CRPS comes back? That is not a good mental frame of mind to have. And I don't just say recovered because I'm trying to trick my brain and think positively. I say recovered because I literally have no fear of CRPS, period. And for example, this is my left foot, which I had CRPS in. I don't know if you can hear how hard I smacked it, but it's a normal foot. I can do everything doctors told me I couldn't do, and I literally do not fear at all anything about CRPS. In fact, if I didn't do this, if I wasn't doing this, I wouldn't think about CRPS at all. But this is my passion and my career, so of course I'm thinking about it. Um, Remind yourself, most people recover from CRPS, and when they do, they move on. They do, and I'll prove it to you right here. There are 200,000 people diagnosed with CRPS per year, according to Google. Okay. In the largest Facebook group that I can find, there are 20,000 people in the group. That group that has 20,000 people has been around for 14 years. It was created 14 years ago. 200,000 people times 14 years, so 200,000 people per year diagnosed, times 14 is 2.8 million people. Now, granted, a lot of people don't use Facebook. That's fine. But let's think about this. 20,000, the number of people in the group, divided by 2.8 million, the number of people diagnosed in the last 14 years, is 0.71% of people. That means that 99.29% of people, based on those numbers, get better and move on with CRPS. Or at the very least, they don't join the group. But that falls in line with the NHS statistics of 85% of people recovering and getting better from CRPS. So I want you to hold on to those numbers and really let that sink into your mind about some of the information that you've heard about CRPS being incurable. And to take it a step further, I want you to really think about the Facebook groups in general. okay? A lot of you have noticed that in these Facebook groups, it almost becomes a contest sometimes when you reach out for help to see who's suffering the most. And it is nice to feel comforted by other people knowing that you are not alone. But if you are absorbing information like this, for example, what is that doing to your nervous system? Are images like this helping you stay calm and relax your fight or flight system? Or are they sending you into fight or flight further? I also want you to know that, a lot of these groups, while they have good intentions, they're not quite your friends in certain ways. And the reason I say that is because, unfortunately, for someone like me who has dealt with CRPS and wants to help people get out of pain, a lot of these groups will ban me. They will block my posts, make them pending. Even posts that are just free information, like my desensitization videos, they won't allow them in the group. And I understand that sometimes you have to be careful about, people selling things or trying to take advantage of people, but I don't think that all the groups have good intentions in that regard. And the reason I say that is because some of these groups, as you're seeing here on screen, are quite literally run by scammers and t-shirt sellers and people trying to get you to buy herbs, etc. Some of the largest groups are run by these types of people. And so I want to encourage you to be very careful with the information you absorb in these groups, especially when it comes to taking health advice from individuals in this group who are either still in pain themselves and acting out of fear and desperation in the same way that you might be, or individuals in the group who have ulterior motives, which could be to stir up negativity, get you feeling emotional, drive engagement on their post, and then scam you in some way, shape, or form. People in the groups have started to notice that this is very common. I'll put some examples on screen now, but there are a multitude of accounts. I'm estimating 60 to 70% of the accounts in Facebook groups like this are fake. And that's not only CRPS groups, that's fibromyalgia groups, that's EDS groups, that's POTS groups. And the reason there's fake accounts there is because they know they can say something scary or post a picture that generates a lot of fear and drive engagement. The more engagement these accounts have, the more followers they get, the more potential money they can make, either through stealing your credit card information or through farming social media points and then earning trust and selling you some sort of real item to fix your pain. This is something that is rampant on Facebook, unfortunately, and it is only getting worse through AI. And so I want to encourage you to be really careful about what you read and what you believe. Make sure your sources are being vetted properly. The reason it is so important to vet the information you are taking in related to CRPS is because, believe it or not, that information can and will directly affect your pain experience. And to illustrate this a bit further, in this section of the video, I'm actually going to insert an excerpt from Module 5 of my online program titled Placebo and Nocebo. And I'm excited for you to learn what you're about to learn here from this excerpt so that I can further talk you through the research in this video around the nocebo effect in particular. So let's jump into that excerpt and I'll see you afterwards. Sticks and stones may break my bones, but words will build my prison. This is Roger Bannister. Some of you watching may know him, but to those of you that don't, he was the first person to break the ever-elusive 4-minute mile barrier in running. This was an achievement long thought to be humanly impossible. Beginning as early as 1886, this achievement was chased by the most gifted athletes and the most brilliant coaches in Europe, Australia, and North America. Still, for decades, no one could get close to the 4-minute marker. It was theorized at the time that there may be a human limitation, that it's just not possible to do, and even if it was, it would need to be done in the absolute perfect conditions. The experts believed that they knew the precise conditions under which this mark would fall. It would need to be perfect weather, 68 degrees with no wind, on a particular kind of track, hard with dry clay, and in front of a huge crowd, boisterously encouraging the runner onto his best performance ever. Bannister, however, was an outlier and an iconoclast. a full-time student who had little use for coaches and devised his own system for preparing for a race. The British press constantly criticized Bannister for his lone wolf approach and encouraged him to adopt a more conventional regiment of training and running. No one believed it was possible, and yet on May 6th, 1954, on a cold day, on a wet track, at a small meet in Oxford, England, and before a crowd of just a few thousand people, Bannister shattered the 4 minute barrier, defying all conventional wisdom at the time. Just 46 days after Bannister's feat, John Landy, an Australian runner, broke the record again with a time of 3 minutes and 58 seconds. Then, just a year later, three runners broke the 4 minute barrier in a single race. Over the last half a century, 1,755 runners have conquered a barrier that was once believed to be impossible. How is it, I wonder, that so many runners smashed the 4 minute barrier after Bannister became the first to do it? Was there a sudden growth spurt in human evolution? Was there a genetic engineering experiment that created a new race of super runners? No. What changed was the mental model. The runners of the past had been held back by a mindset that they could not surpass the 4 minute mile. When that limit was broken, the others saw that they could do something that they had previously thought was not possible. This story is an amazing demonstration of the power of words on our perception. It illustrates how information, even from experts, can sometimes hold us back from achievements we once thought may be impossible. This not only applies to athletics, but in all other areas of our lives as well. Words have power, not only to help us, but also to harm. One way in which words help is through the commonly known placebo effect. This effect is when a person's health improves after taking a fake or sham treatment that is designed to have no therapeutic benefit at all. The word placebo comes from the Latin root placere, which means I will help or I will please. This effect occurs when a person's belief in the treatment and their expectation of feeling better trigger a beneficial health response. Placebos can be inactive substances, such as sugar pills, or there can be actions that resemble a medical treatment, such as a fake surgical procedure. The placebo effect works by activating the body's natural mechanisms for feeling better, such as reducing pain, stress, or anxiety. This effect is so powerful that in many studies on medications and surgical procedures, the outcomes of having the real medication versus the fake one, or having the real surgery versus the fake one, are nearly identical, meaning those that have the surgery do just as well as those that had the fake surgery. So, in summary, if you believe that something will help you and someone you trust reinforces that belief, then in all likelihood, it will help. There is also a reverse to the placebo effect that many people aren't as familiar with. It's called the nocebo effect. The nocebo effect is a negative reaction to a treatment or intervention that occurs because the patient believes the treatment will cause harm. The term nocebo comes from the Latin root nocere, which means to harm. The placebo effect can cause real adverse reactions such as headaches, gastrointestinal issues, pain, erectile dysfunction, and even dangerously low blood pressure. The nocebo effect is the opposite of the placebo effect, where a patient experiences a positive outcome due to a positive expectation. Both the nocebo and placebo effects can be extremely powerful and are influenced by brain activity. Knowing this, consider, for example, a case in Nashville, Tennessee, where a man was diagnosed with esophageal cancer. Surgeons successfully removed the tumor on his esophagus, but further scans later revealed that the cancer had spread to his liver. He was told by his doctor that he would be lucky to live until Christmas. The man made it to the holiday, but died shortly after in early January. At first glance, this story might seem like another tragic case of cancer taking life too soon, but autopsy revealed that the patient had been misdiagnosed. The tumor on his liver was small, operable, and could not have killed him. Could the news alone of his impending death from his doctor have been enough to take his life? That was the conclusion of his doctor, Clifton Meador, who described the diagnosis as a type of medical hex, aka nocebo. Obviously, death by nocebo is an extreme example, but this effect is still seen in smaller examples, such as with allergies, rashes, and even pain. John Nolan Mackenzie was one of the early pioneers to examine nocebo effect in medicine.
In the 1880s, when working at Baltimore's Eye, Ear, and Throat Charity Clinic, he was asked to examine a woman with severe asthma and terrible hay fever. She reported that when she was exposed to pollen, her nose would run incessantly and her eyes would itch so badly that she wanted to tear them out with her hands. She said that it was so bad that she needed to spend the entire summer indoors, and it was impossible for her to keep flowers in the house. Even the sight of a distant hayfield was enough to set off her symptoms. Mackenzie never detailed what made him skeptical, but something about the woman's description of her symptoms led him to question the role of pollen in her clinical presentation. To test his hypothesis, he commissioned an artificial rose to be created. The fake rose was created with such accuracy that it was nearly identical to the real rose. Prior to seeing the patient, he carefully wiped every petal of the fake rose down to ensure that no pollen could have possibly landed on it in transport. He then positioned the rose behind a curtain in his exam room. When the patient arrived, Mackenzie spent a considerable amount of time completing a thorough examination of the patient and noted that she displayed no symptoms. After this, he pulled back the curtain to reveal the fake rose behind it. The woman's response was shocking. Immediately upon seeing the rose, her voice became hoarse, her nose stuffed up, and her eyes began to burn. When Mackenzie then examined the woman again, he was surprised that she had actual, visible irritation present in her throat, nose, and eyes. It was a clear indication that this patient was not faking her symptoms. Mackenzie concluded in this case that nocebo was the cause of the patient's illness. When Mackenzie explained his findings to the patient, she was completely stunned. Mackenzie allowed the patient to take the fake rose with her, and she examined it in great detail, verifying that it was indeed artificial. When she later returned for follow-up, she was able to bury her face in a bouquet of flowers without any adverse effects, and all symptoms resolved. As you can imagine, the placebo response is a powerful medical tool. The nocebo response is of great concern for medical providers. Even just the phrasing of a medical procedure can influence and increase your pain. You have probably experienced the effects of nocebo yourself when a doctor or nurse says, "This might hurt," when giving an injection or taking a blood sample. This effect has been illustrated in countless studies, including one on pregnant women receiving an epidural. One group of women in this study were told, "You are going to feel a big sting. This is the worst part of the procedure." And another group was told, "Don't worry, you will be comfortable throughout this process." Following the epidural, the group that was told it would hurt reported significantly more pain than the other group. Additionally, when someone is warned that they will feel pain, there are observable changes in both the brain and spinal cord following that warning, showing that the symptoms resulting from the warning are very real.
As a doctor of physical therapy and fellow of pain science who specializes in the treatment of pain, I have witnessed the effects of placebo and nocebo on my patients many times. In fact, when meeting a patient for the first time, I can often tell how long it might take for a patient to recover just based on their beliefs about their pain and what they have been told by other medical professionals. Outside of the clinic and in my personal life, I have felt firsthand the effects of nocebo on my mind. The image you are seeing now is an MRI of my spine. I was 22 years old at the time, and the orthopedic surgeon who was trying to fix my back pain told me that I had the spine of a 70-year-old. He also stated that he does 100 microdissectomies a year, and my herniation was the worst he had ever seen. He pointed to my herniated disc and stated that it was the cause of my pain, and in my own fear, I went on to have two surgeries on my L5S1 disc. What I didn't know at the time was that disc herniations are rarely the cause of pain. In fact, there are many studies showing that people often have a herniated disc without any pain at all. This is true for many other conditions commonly associated with pain, including rotator cuff tears, meniscal tears, labral tears, and much more. A study involving 3,110 people from the ages of 20 to 80 showed that disc herniations, disc bulges, and disc degeneration are present at all ages and likely not causative of pain, considering that this study of 3,110 only included people with no pain whatsoever. After my surgeries, I developed a severe and unrelenting pain in my left foot. I went to doctor after doctor for many months trying to understand why, and eventually I was diagnosed with complex regional pain syndrome.
I was told by my doctors that I would live with it for the rest of my life. I was given an intramuscular EMG and told that I had irreversible nerve degeneration. I was fed pills to the point that I was eventually taking 16 a day and using a walker to get around. I lost nearly 60 pounds and went from playing college football to not being able to even wear socks. When I sought answers online, I only saw worse news. I read that CRPS is incurable, that it is lifelong, that if I got remission, it would only last for 4 years. I was told to get used to it, and I was even told that it would spread, which of course resulted in me waking up the next day to find it had spread to my knee. I was told many things on my journey as a CRPS warrior and now as a pain specialist. Many of them were just not true. I treat patients every day who recover from CRPS despite the messaging around it, and I've been out of pain for 7 years. I was told my pain would never go away. I was told that I would never run, never squat, and never deadlift again because my spine and foot were too fragile. Today, I have just one message for my colleagues in the medical field. Watch your language. It might be the only thing stopping your patients from truly healing.
As you can see from that excerpt in my online course, the placebo and nocebo effects are profoundly powerful. They are so powerful that researchers literally have to account for the placebo effect whenever they study a medication. The medication that is being introduced has to beat the placebo group in order for it to be considered effective. So, what I mean by that is when they test a medication, they give one group of participants a fake pill and they give one group of participants the real pill. And a lot of times, the real pill that is actually chemically altering the body doesn't do any better than a fake pill that people believe is altering their body. And so, if the placebo effect is that powerful, you have to really think about how powerful the nocebo effect can be. And then take and apply that to reading information online about CRPS, such as the dentist being your enemy, such as ice being your enemy, such as spreading happening after a certain number of years, and all of the misconceptions and misinformation or ideas around stages, remission, types, etc. You by no coincidence at this point in the video are saying, "Oh my gosh, I've probably been affected by the nocebo effect when it comes to my CRPS." And I was too. I was afraid to squat for almost 6 years, even after I was out of pain, because of things doctors and other patients had said to me. Let's dive a little bit further now into the research behind the nocebo effect. As a reminder, a placebo response occurs when positive expectations influence the body's response to a treatment or experience. And a nocebo response is the darker side of that phenomenon. Negative expectations can increase symptoms, including pain. And here's the thing I want you to know. Nocebo does not mean imaginary. That was proven to you by the Rose experiment in the video that I just showed. And there is actual real changes happening in the body from nocebo. The pain is real. The nervous system has changed how it processes the pain experience just from the nocebo information. And where this becomes incredibly relevant, of course, is in support groups, because humans learn by watching other humans. A 2023 systematic review and meta-analysis observed observational learning and the effects that it had on placebo and nocebo pain responses. Altogether, this systematic review and meta-analysis included 764 participants. Observational learning produced a measurable effect on pain ratings, but the effect on pain expectations was even larger. In other words, watching another human experience more or less pain helped shape what observers expected to experience themselves. And those expectations were capable of influencing their subsequent pain experience. Earlier experiments demonstrated similar effects. Researchers have induced nocebo hyperalgesia simply by having participants watch another person appear to experience greater pain under certain conditions. Think about the implication of that. We don't necessarily have to personally experience something dangerous before your nervous system says, this is dangerous. We learn socially. So imagine you're on Facebook support groups and you're reading, cold caused the worst flare I've ever had. My CRPS spread right after surgery. Physical therapy destroyed me. I tried walking farther and I couldn't move for 3 days. That medication ruined my whole nervous system. Now imagine reading thousands of stories like that over several years. Again, that doesn't mean that the people posting these comments are lying. Their experience deserves compassion and is likely very real. But another person's experience is also information entering your nervous system. And what does the brain do with that information? It starts to make predictions. So then, when you encounter cold, when you're scheduled for another surgery, when your therapist asks you to move, when your heart rate starts to go up, and when another body part tingles, your brain may already have a prediction waiting. This could be dangerous. This means more pain. This means spreading. And this is the problem when it comes to nocebo effects in Facebook groups. Remember, fear can be learned by watching. Fear can be learned socially. A classic experimental study by Helson and colleagues had participants observe people performing cold pressor tasks. Certain visual cues were paired with models displaying painful facial expressions. After watching those models, participants reported greater fear of pain and expected the associated task to be more painful, even though they had not personally experienced that relationship themselves. The researchers concluded that humans can acquire pain-related fear through observational learning alone. Now let's translate that to CRPS. Someone writes, I used my hand too much and I had a flare. And so your nervous system learns using my hand equals danger. Someone writes on Facebook, my doctor touched my foot and I screamed for 3 days. Your nervous system learns touch equals danger. Someone writes, I wore a shoe and my CRPS exploded. Nervous system learns shoe equals danger. Someone writes, exercise made my pain spike and made my CRPS spread. Nervous system learns exercise equals danger. And then eventually your life gets organized around trying to prevent that danger. Because of that continual message of danger, we get stuck in the fear avoidance cycle that I mentioned earlier, as shown by this model. We go around and around this loop until we can get past the fear of what is happening when it comes to CRPS. Support groups can create hypervigilance. Before you were diagnosed with CRPS, how often did you compare the temperature of your left leg to your right leg? How often did you inspect your veins, your hair growth, your nail growth, your skin color, your sweating, tiny amounts of swelling, random itching, pins and needles, whether your limb looked slightly redder under a different lighting? If you're honest with yourself, you didn't do any of that. But after diagnosis, suddenly these things become important. And support groups can massively expand the number of symptoms you know to look for. If someone posts, does anyone else's fingernail grow differently? You're immediately looking at your fingernails. If someone posts, does anyone have visible veins? You start inspecting your veins. If someone posts, my opposite hand was colder today, you start comparing the temperature of your hands. And once the brain learns this information matters, it becomes better at detecting it. Pain research has long demonstrated an association between attention to pain and constructs including pain-related fear, catastrophizing, and fear of movement. In chronic pain populations, greater pain vigilance is strongly related to these other pain-related psychological processes. So if you see a post that says, does anyone else's leg look slightly red? Your attention goes to that. You start to think, wait, does my leg look slightly red? You check your body. You find a difference somewhere, even if it's a small patch. You then interpret that as oh, is it spreading? That creates anxiety. That creates more checking and hypervigilance. And then you enter back into the loop of chronic pain. The more important a sensation becomes, the more closely you monitor it, and the more closely you monitor it, the more sensations you find. This doesn't mean the sensations aren't actually there. It just means that you have changed how much importance and attention the nervous system gives it. Another thing to consider when looking at CRPS support groups as a whole is the reinforcement of pain behaviors. And what I mean by that is not that people are behaving like they're in pain on purpose, but that when you're in a support group, oftentimes a post about how bad your pain is will receive a lot more attention than a post about you having a good day, or even more so, a post about you overcoming a pain condition. And this is very evident in CRPS support groups. If someone posts something about, the worst flare of their life, they will get 300 comments, 57 likes, a whole bunch of engagement. And on social media, that is a perceived reward that you experience. And as a human, that feels good. Whereas posts about having a good day, overcoming pain, that doesn't get quite as much attention. And, what I've noticed in these online support groups is not only does it not get attention, oftentimes those that claim that they have overcome CRPS, such as myself or my clients, or even people I don't even know, get actually attacked and ridiculed. For example, there are several people who make posts every so often stating that every year they try to come back to these support groups and state that you can overcome CRPS, and they are attacked by people. There are some comments saying, yes, I agree, we can get through this, but the majority of the comments are negative. Additionally, I have had clients personally post their own story in these support groups, and they're not only attacked, but people will often use vulgarity and profanity at them. They will tell them to, F off or get out of the group. And it's very heartbreaking because these are the exact people that you come to a support group to find, the people that got out of pain. And so, this is a hard topic for me to illustrate how pain behaviors can be reinforced in support groups and how our perception is reality. So what I want to do for this section of the video is I actually want to show you me having a conversation about this with a client of mine and his mom. Okay, so who you're about to meet, when he met me, he was barely functioning due to the pain. And now, after several weeks, he is back to soccer and having a wonderful time just being a normal kid. And so I'm going to show you that clip and then we'll get back into the rest of the video.
Feel like this is pretty checking.
You
I
said
don't know.
you said something to Daddy that was really cool the other like last week after practice. You said you have no pain.
Oh yeah.
Nice. That's gonna,
That's like we should celebrate that.
yeah, that's gonna happen more and more until you move on from this. Here's what a message I want to give you, bud, and this is what I'm gonna talk about at dinner as well. You have CRPS, you are not CRPS. And eventually that becomes I had CRPS. And the reason I
Right.
say that is because it is a very tricky situation when you are diagnosed with a condition like this that has a lot of misinformation around it to identify for your whole life as a warrior. You are
Right.
special for a ton of reasons, Rylan. You are a really smart young man. You're athletically talented, okay, strikingly good looking, might I add. And you don't need CRPS to be your identity. And so
No, and I
as you
don't want it to either because it's like holding me back kind of. It's like basically saying like, oh yeah, I have a lot of pain.
right.
And like I I lived through that phase and I didn't like it.
Yeah,
And it did hold me back, so
right. And now that we're transitioning to this new phase where our pain is coming down, almost totally gone for good, we can let go of that identity that we had at one time. That's,
Yeah.
yeah. Yeah.
A
We're,
thought just popped into my mind. I remember when we were at Soren's practice and we were doing like module one and like I couldn't even like run. We were sitting down nice.
Oh yeah.
I was still like on crutches at that point, I think.
That's when we were doing the self-guided tour. Like we hadn't
Right.
even hooked up with Chase yet, and we were at Soren soccer practice, and I was having him watch the modules with me,
yeah.
and he didn't want to watch them. And actually, a few weeks before that, I asked you to sit down and watch one on the TV, and you had a really hard time with that. You remember that?
Yeah.
You remember why?
No, I don't. I forgot.
You had told me you didn't want to see anybody that was better because that was hard for you because
Yeah,
you weren't there yet.
that makes sense.
And look at you
But
now.
now I am.
Now you're one of those people.
Yeah.
That's,
I
that's
just
right.
remembered that moment and it was really funny. I was like, I don't know. It was funny.
Yeah, that
Yeah.
was funny.
It's cool to look back and see how far you've come.
Yeah.
And now we can, you know, as the pain continues to be gone for periods of time, eventually it will become gone for good. And we can, if I didn't do this for work, I would never talk about CRPS. I never would. I wouldn't think about it. Wouldn't even cross my mind. That's where I want to see you. And, you know, once a year, you can come to the client meetup and we can celebrate, you know, the memories of how far we've come, but it doesn't identify us, right? It
Right.
doesn't define us anymore.
Do you have a different relationship with it now because it's like it's your job, it's not your identity, it's just something you speak on versus like living it?
Oh yeah,
Yeah.
100%. And I think I got lucky because the first time I joined like a support group and
Hmm.
I read some of the things going on in there, my mind was basically immediately, no, this isn't going to be me. And I left.
Hmm.
And I think that served me really well.
Like it wasn't going to be you in which way?
I was not going to fall into the pain as a trap. I was not
Oh,
going to let it
gotcha.
be my identity. I was not going to
Yeah, be in
other,
there complaining with everybody else and yeah.
yeah, yes, and I was not going to other everyone who wasn't in pain.
Hmm.
And that's something that is really hard with support groups is that what happens is there's a reinforcing mechanism to it. So for
Hmm.
example, a post about someone getting well is not received in a good way. It gets 7 likes, it gets 10 comments saying you never had
So
CRPS
interesting.
anyways,
Yeah,
right? And then
right.
a post of someone having a really bad flare gets 300 likes, 15 supportive comments. And if you are someone who is on social media, you know that it feels good to get likes.
Hmm.
What does that do to you psychologically? Well, then it
Interesting.
reinforces.
Yeah.
Yes, right. It
Yeah.
reinforces things. So when individuals send me video of someone on TikTok who's got 1 million views for showing how they're in pain in the hospital,
Yeah.
I
Yeah.
want to help that person, but I get nervous because they are actually having their pain reinforced in a positive way. If
Right.
they're suddenly better,
No
they
likes.
they lose something. Right. And
Yeah.
I don't think people are doing this on purpose.
Right.
It's just a danger of it. So here's another example. When I would meet kids at Texas Children's, one of the first things we would ask is, what would be bad about getting better? If they
Yeah.
said, well, nothing, I want to get back to sports, I want to do this, I want to do that, then we're like, okay, good. That's reflective of a good outcome. But if they
Yeah.
said, if I get better, I no longer get as much attention from mom, I have to go back to school, I'm
Right.
worried, I have to focus on my homework more often, then we're nervous because
Hmm.
it's called a pain reinforcing mechanism. Secondary gain is what it's called.
Right.
That's where we get nervous. And so Rylan, you know, you didn't have that challenge. You wanted to get back to sports, you wanted to get back to your stuff. But
I was
with
really sad without it.
right, and with kids and adults alike, there are some situations where the pain is actually helping. And so that's when it gets complicated and hard. And yeah, it's so that's a big thing about identity. We don't want CRPS to define us. You have all these other things that are way cool, Rylan. So
Yeah.
let that stuff define you. And when we get to the client meetup in a month or so, that's what you'll see about those around us as well. And that's what I'll speak about at our dinner.
Yeah. And I feel like I like it did feel good to get like a lot more attention, and it was fun. Well, fun for like having the attention. The pain was not fun,
Right.
but it was like part of it did feel good. And like
True.
with as I went on with that, like still having to like try a new school, but like not really try at the same time, but still have the pressure of school, but like it didn't really matter if I did or not. It just like distracted me, and like I did online school, and that wasn't working out because I didn't see anybody all
Yeah.
day except for my
Yeah.
mom, my dad, and my brother. And that was just
Yeah.
there's just like
Yeah.
for some people that could be like an enjoyable situation where it's like I don't really have to worry about my school. I don't really have to worry about this. I gotta kind of do whatever I want. But like
Mhm.
I just don't think I could live that way.
Right. In the beginning, it feels interesting. You know,
Right.
it's like at especially in elementary school or middle school, you break your arm, everyone's signing your cast. You know, you're celebrity. You know, you're different. People are moving out of the way. They're helping you get to class because of your crutches, right? Well, if you're broken arm, it's not crutches, but you get what I mean.
Yeah, yeah, yeah.
In the
It's
beginning,
like
it
the
is
help
exciting.
care.
Yeah. In the beginning, it is hard, but it does feel nice to get some extra care, right?
Right. It
Um,
feels validating,
yes.
helpful.
Yes, that you feel understood in certain ways. The danger
Right.
is if that becomes our default mechanism for getting extra care and feeling understood. And that is where that part gets dangerous because CRPS, it's called we call it the invisible illness because we have this deep desire emotionally to be seen and understood. Pain in some ways can help us get that. And
Yeah.
so that's a big reason why when we meet and you know when we talk about this, I say, hey, let's get back to the things we love as fast as possible, even if there's
Yeah.
pain, and then the pain goes away after.
Right. I do feel like also like going back to soccer and it being like fun.
Yeah,
Sorry, it's in my
you're
eye.
good.
Like when it wasn't fun, that was hard, and I feel like I was focusing more on the pain. But then after, I feel like when I got a little bit better, my teammates passed, I feel like it was so much easier to not focus about it and like just
Yeah,
play and enjoy and have fun.
yeah,
I feel like that got easier
yeah,
as I was doing what I loved.
yes,
When the
yes,
science around like what you focus on becomes bigger and bigger, even if it's not pain, right? Even if it's like, oh,
correct.
everybody has a yellow car now, or we were talking about the orange car, right?
Yeah,
Like
Yeah,
you notice something and then you just see it everywhere. It's like,
my
yes,
dad, my dad was looking at like if he wanted to get a new car because his car's like 5 years old now.
it just has a lot of miles on it.
Or that. I don't know. But he's looking at this new like orange Honda and then I don't know the
just saw it
Honda.
everywhere.
But then
Everywhere.
yeah, we went to
And it's
we
like
were
an
just
orange car. It's not like super common, but it's everywhere.
we were
Yeah,
driving to this field that was 8 minutes away from us. And sure, there was car dealerships, but we saw a ton of orange cars like on the road. And
yeah,
then at Soren's game, my brother, there was one exact car right there. I mean, he's gonna
yeah,
get like a newer version with different like features, but it was the car that he was gonna get. And it's like,
yeah.
wow.
You're demonstrating a really good point, you know, in talking about support groups and how challenging and dangerous they can be in certain ways. What you focus on will become your reality. It's just the truth, right? So if he's
Right.
looking at buying an orange car, suddenly you see orange cars everywhere. If you're on a
Right.
Facebook group and you read that ice makes it worse, suddenly it's making it worse. It's
That
you,
is true.
your perception is your reality. Here's another example. Do you like rainy days or no?
Yeah, I love rainy days.
You love them. Okay, so there you go. When rain shows up, you're excited. You enjoy that.
Yeah.
Maybe it helps you sleep
Yeah.
better. Maybe you like to be outside. There are people who dislike rainy days. And so what happens when a rainy day comes for them? They're sad, they're depressed. It
That's
it
me. We're
Right.
opposites.
Right. And so that's pure perception. The rainy day is exactly the same, but you're
Right, but
perceiving
I'm
it.
happy. I'm excited. I'm going outside. I feel energized. She's
Right.
like
Okay, but I
falling
think there's
asleep.
something else there because the sun is an energy source. I do feel more tired on rainy days.
Right.
Yeah,
So that's the thing though, is that is conditioning, that is perception, that's reality. Uh, a lot of people don't like the dentist. My father was a dentist. I love the dentist. And so, it's in CRPS groups, that's the difference between like my Facebook group versus the typical ones you see. In my Facebook group, it's all stories of triumph, success, even the hard times we're saying we're at least I'm getting better, at least I'm learning. In a
Yeah.
lot of the public Facebook groups, all the stories are stories of fear. And so if you're inside those as a mom or as someone dealing with CRPS, you are trapped in a perception.
Mhm.
That's exactly why, Rylan, my shirt, pain isn't your prison, it's your power. That's my message is get out of the mind prison, step into your
Yeah.
power, get back to soccer, have a great life.
yeah,
When you
Yeah.
learn, like, you learned, like, how powerful your brain is, and like, you just unlocked your own brain. Like, think
oh
about
yeah.
all the people out there that are stuck.
I could start levitating stuff.
Yeah, any minute now. Yeah. But it's
Okay,
true.
so
It
you're
is.
just gonna start flying.
Yeah, I'm actually floating now. There's not even a chair here.
See,
Yeah.
I can just speak it into existence. I don't even have to think.
It's funny because we laugh about it, but there really is such a power behind it. And all professional athletes talk about it, um, very good musicians that are gifted in that way, they talk about it. I had this belief in myself, and that's what you did when we started meeting together, Rylan. You had this, I think by the time we were meeting together, I think in the beginning you were really doubtful, but by the time we meeting together, you had
Yeah,
kind of made up your mind, I'm going to do this.
I did. I do feel like that happened. I feel like that was kind of a shift. And then I feel like, I don't know, it was like literally like two or three meetups. And then I got to tell you I was jumping again.
Yeah,
It was
yeah.
that, it was like,
Yeah,
You
your
did.
sequence of events is pretty interesting because, like, when I was asking you to watch the modules, it was like, no, I won't even watch this. I won't even, like, shut down, right? And then
I
I
watched
had
it.
signed up for your self-guided whatever, and after thinking about it for months, and I was like, no, we really need to do this, and then I got panicky and was like, I think I signed up for the wrong thing. What if we're not even on the wait list? And then you and I talked, whatever, and you got him in, and I was like, oh my gosh. And then by the time you got him in, I was like, I'm so thankful because, like, it's bad, right? Like,
Sure.
Yeah.
but then it was like there was this whole like experience that he had had where he had already been at his worst and like was crawling around the house and couldn't walk, and we were thinking about wheelchairs and stuff like that and walkers and stuff, and he had already started to come out of that a little bit. um I don't know. I think you were in the right mindset when, like, Chase, like, opened his arms to us to be able to, like, to
To-
talk. Like, it seemed
Yeah.
like the timing really worked out where you were ready and he was ready and stuff.
Yeah.
Yeah. I
Yeah.
mean,
I'm glad for that.
Yeah, me
yeah.
too. Me
I
too.
I hope that clip with Rylan and his mother gave you some perspective. Rylan is not an outlier. He is not a unique person in the fact that he has gotten better and will move on from CRPS. In fact, Rylan is the common individual when it comes to this. Most people move on from CRPS. And that brings me into one of the last topics when it comes to support groups and the issue with support groups. There is another major reason you need to be careful when you are interpreting disease support groups, and that is something called selection bias. And what I mean by this is imagine 1,000 people develop a painful condition. Many recover quickly, some improve gradually, some have mild persistent symptoms, and some have very severe symptoms. Now ask yourself, who is the most likely person to participate in a support group every day 5 years later? It is probably not the person who recovered and went back to living their life. They may have even left the group years ago. The person still struggling desperately for answers has a much stronger reason to stay in a support group. So when you enter a support group, you are not necessarily looking at a random sample of everyone who's been diagnosed with CRPS. Chances are you are looking at the people who are currently participating in that support group. And that distinction matters enormously. The reason for that is because somebody in that group might say, everyone I know with CRPS gets worse, but everybody that they know with CRPS may be the people they meet in a group specifically for people still struggling with CRPS. That's not epidemiology, that's selection. And I personally have been kicked out of or not allowed in support groups because I am not currently dealing with pain. Your Facebook feed is not an epidemiological study. Anecdotes can be harmful and they cannot reliably tell us how common something is, whether a treatment works, or whether one thing caused another thing, or what will happen to you. So you have to be careful when you are in a group listening to anecdotal stories, meaning stories by one or two people, and they're stories from the people who are the most rare when it comes to CRPS or people who are still actively in pain. What we need is a support group that is filled with people who are out of pain, more conscious of the process that it takes to get there, and people who are less fearful as a whole so that they can bolster others in the group as they ebb and flow in and out of fear. And so, what I'd like to leave you with today is what does a healthy support group look like? After everything I've said, I don't want the takeaway to be leave every CRPS group immediately. That's not what the research supports. Instead, I want you to audit the environment of the group that you're in. A healthy pain community should provide connection, meaning you don't have to do this alone, validation, meaning that they believe you and what you're going through, accurate information, meaning well vetted information to distinguish what we know from what people are just assuming, hope, so stories of people who have improved, agency, meaning giving you power to do things next, by extension, self-efficacy, meaning empowering you to build your own capacity, function, they should get excited about functioning and getting back to doing things, and life outside of pain. Most importantly, you should be in a group where there are recovery stories. There are videos and pictures and images of people who have gotten better. Again, if you want a group that shares that constantly, my Facebook group is full of it. There are constantly photos of my clients challenging themselves, working on themselves, pushing their bodies, reducing their pain, going from bed bound and wheelchair bound to walking and running. That is what is full in the window pane group, and I would love to have you there anytime. So if you've made it this far in the video and you're not in that group, please do join us. What are the red flags of a Facebook group if you're looking to join one? Red flags would be any group or any chronic pain community where the dominant message is CRPS always gets worse. CRPS always spreads. There is no cure. Movement makes CRPS worse. Never push yourself. If you have pain, it means you've done something wrong. Every new sensation is CRPS. Doctors are evil. Flares mean you've injured yourself. No one ever gets better. Protect your limb at all costs. These are not harmless statements. These are predictions about danger, and your brain listens to those predictions. So when you're in support groups, I want you to do this test. Spend 15 to 20 minutes scrolling through the content in that group. Then close your phone and ask yourself, how do I feel right now? Do I feel more hopeful or less hopeful? Do I feel more capable or less capable? Do I feel safer in my body or more afraid to move it? Am I more willing to move or more afraid to move? More focused on living or more focused on my symptoms? All of these questions should be in your mind as you go through and scroll through support groups, because what you feed your mind will become your reality, as I talked about with Rylan and his mother. In conclusion today, I want to end this video with compassion. Look, nobody joins a support group because everything in their life is going well. People join support groups because Western medicine has failed not only CRPS, but a large majority of the conditions that I call alphabet syndromes. They join support groups because they want to meet people who understand. They want to be heard and seen for maybe the first time in dealing with their condition. Their family doesn't understand them. Their coworkers don't understand them. Their friends are abandoning them, and doctors are telling them it's all in their head. It makes total sense that you would join a support group, and I am not against that. I just want you to consider what certain groups may be doing to your mental and emotional state, which in turn will affect your physical state and your pain. I hope that this video today was helpful for you to understand all of the dynamics that go into my stance on CRPS support groups. And I hope that you understand why this video was so important for me to make today. I would love to hear your own experience of support groups as a whole down in the comments below, whether positive or negative. And I'm excited to continue this series with you and share hopefully just as helpful information in each iteration to come. If you're not already, make sure to subscribe to my YouTube channel. If you have found these videos helpful, please leave a like on the video because that helps other people see it. And I will see you in the video coming out next weekend. If you would like to review some of the videos already out from this series, go ahead and just click this picture right here. I know you want to. There's so much to learn. And if you're at the end of this video and looking for hope today, go ahead and click this picture right here. Because as I said, healing from CRPS is not uncommon, and that video proves it. Thank you guys so much for watching, and I will see you in the next video. Take care.